and concerns growing over the ongoing Ebola outbreak in the Democratic Republic of Congo, plus the United Nations highlighting a worsening hunger crisis in Haiti, and also the World Health Organization releasing new global guidelines to strengthen the treatment and management of Ebola and Marburg disease. So these are our stories for today, and much more is coming up. Let's get into it. You're welcome. In our top story today, thousands of Ugandans are suffering from untreated hernia and are expected to receive life-changing medical care following the launch of 1.5 billion health initiative by the Rotary and its international partners. So this project aims to improve access to affordable hernia surgery while strengthening the country's surgical capacity in the eastern and in the central Uganda. At least 4,000 patients are expected to benefit from this initiative, which was launched officially on Wednesday at Kamuli Mission Hospital. And this project is funded by the Lottery Foundation in partnership with the Lottery Club of Sidmouth in the United Kingdom and the Hernia International. So this initiative seeks to reduce the growing backlog of the untreated hernia cases by establishing 5 specialized surgical centers and equipping hospitals with modern medical equipment, plus medical training the medical healthcare workers to deliver quality surgical services. So the beneficially health facilities include Kamuli Mission Hospital plus Chambira Surgical Center in Jinja City, St. Francis Health Center in Njeru, plus Herona Community Hospital in Chisoga, plus Mukono District and Holy Cross Hospital in Chichusa Luwelo District. So according to the health experts at untreated hernia disease continues to affect thousands of people, particularly in rural communities, and the cost of the surgery remains beyond the reach of many families. So as a result, many patients delay treatment, exposing themselves to prolonged pain, complications, and loss of productivity, plus financial hardship. So speaking during the launch, Dr. Gavin Mukalazi of Herona Community Hospital said one of the biggest challenges has been the high cost of commercial surgical mesh and also essential material used in the modern hernia repair. He explained that because of the mesh because the mesh is highly expensive, many hospitals are forced to rely on traditional suture-only procedures, which have a higher chance of hernia returning. So he also noticed that the project will support the local production of affordable surgical mesh, enabling more hospitals to be able to perform modern mesh-based repairs at a lower cost, while also improving patient outcomes. And under the project, participating hospitals will also receive modern surgical instruments and sterilization equipment, plus autoclaves and water distillers to improve on the infection prevention and ensure safer surgical procedures. Anna Tulumanya Karunmuna, the executive director for Chambiwaf Surgical Center, said that hernia surgeries account for nearly 80% of all surgical procedures in Busoga sub-region. And she also noted that increasing access to the affordable mesh repairs will help reduce the large number of untreated patients while enabling hospitals to become more self-reliant. So beyond the equipment, this program includes specialized training for surgeons, nurses, and biomedical engineers to ensure that the new equipment is properly maintained, and also the quality surgical services continue long after the project ends. So Dr. Maiso of Kamuli Mission Hospital said that this partnership will greatly improve our patient safety, plus also strengthening the quality of surgical care offered at the participating facilities. Kamuli District LC5 Chairperson Kaloli welcomed the initiative and encouraged residents to make use of the improved services once they become available. Now, the project implementers said that the long-term goal is to create a sustainable model for affordable hernia treatment by strengthening regional hospitals and also improving the surgical capacity and ensuring that thousands of Ugandans can access safe and timely operations close to their communities. So, the 1.5 billion Ugandan shillings Rotary funded initiative is expected to transform hernia treatment in the eastern and in the central Uganda by extending access to affordable surgery, plus reducing the backlog of untreated cases and strengthening healthcare systems for the future to come. Now, moving on to our story for today, the Ministry of Health has launched a new digital monitoring system that will be able and enable health workers to track maternal and newborn health data in real time, marking a major step towards reducing the preventable deaths among mothers and babies across the country. Now, the digital platform, which is currently being piloted into the districts of Mukono, Chegegwa, and Kasese, replaces the traditional monthly reporting system with a daily electronic reporting, allowing health authorities to respond more quickly to the medical emergencies and emerging health challenges. Now, the system will collect real-time data from healthcare center 3s and 4s on key maternal and newborn health indicators, including antenatal care, attendancy, and normal deliveries, C-sections, and also low birth weight babies, stillbirths, infant deaths, and other critical maternal health care outcomes. Now, officials said that the new platform will strengthen surveillance of maternal and newborn deaths by providing timely information from lower health facilities where the majority of deliveries in Uganda take place. Now, speaking during the launch of the digital tool, the Commissioner for Reproductive and Child Health at the Ministry of Health, Dr. Richard Mugahi, said that the innovation will significantly improve the government's monitoring and maternal perinatal health outcomes while enabling faster interventions whenever challenges are identified. So Dr. Mugani explained that unlike the previous systems where health facilities submitted reports once every month, this new platform will transmit information from a daily basis, giving district and also national health authorities immediate access to data driven and needed for timely decision making. He noted that the faster reporting will reduce response time to emergencies and also improve planning and resource allocation, plus ultimately contribute to better health outcomes for mothers and newborns. Now, the electronic platform is designed to capture information directly from the health facilities before transmitting it to the district and national health authorities for analysis. And this will enable health managers to quickly identify trends and detect areas with rising maternal or newborn deaths and also deploy appropriate interventions without unnecessary delays. So under the new systems, the health workers will enter information electronically using the digital devices, while the health facility managers will monitor daily service delivery and performance trends within their respective facilities. Now, the ministry says that the pilot districts were deliberately selected because they experience a high burden of disease outbreaks and require strong health information systems to support the faster public health responses, and information officers stationed at participating health facilities will be responsible for entering and submitting the data to the district authorities, ensuring that any emerging health concerns are identified and addressed promptly. So this initiative is being implemented by the Ministry of Health with support from the CDC Foundation and Coalition for the Health Promotion and Social Development, commonly known as HELPS Uganda. Now, health officials believe that the digital platform will improve data quality, strengthen accountability across health facilities, and support evidence-based planning aimed at reducing maternal and newborn deaths in Uganda. So the Ministry of Health says that if the pilot phase proves successfully, the real-time digital reporting system could be expanded nationwide to strengthen maternal and newborn health care and also improve the survival rates of children and everyone across Uganda. Now, moving on to our third story for today. 1 month after the World Health Organization declared the Ebola outbreak in the Democratic Republic of Congo a public health emergency of international concern, health workers said that the response remains under immense pressure as shortages of personnel, equipment, and funding threaten efforts to contain the deadly virus. So health officials report that the outbreak caused by the rare Bundibugyo strain of the Ebola virus has now surpassed the 800 confirmed cases, raising fears it could become one of the worst Ebola epidemics ever recorded in the world. And despite the intensified response efforts, aid agencies say that thousands of people who may have been exposed to the virus have not yet been traced, while many patients are either unable to access the treatment or leave isolation centers before completing the care. So the outbreak continues to spread through the Eastern Democratic Republic of Congo, particularly in areas affected by the armed conflict and also population displacement and also intense mining activities, making surveillance and contact tracing extremely difficult. Now, health workers on the ground said that they are struggling with severe shortages of ambulances and also isolation facilities, and also the protective equipment and trained personnel. And in some communities, suspected Ebola patients have reportedly waited for hours without transport to treatment centers because emergency teams lack enough vehicles. And according to the Africa Center for Disease Control, Africa CDC, and Prevention, only a small fraction of the personnel and vehicles required for self-burial and also patient transport plus decontamination are currently available and significantly slowing the response. Officials warn that insecurity in the affected areas continues to hamper operations, with some patients escaping treatment centers while others remain in their communities without even receiving proper medical care. And although the Congolese government said that more than 1,000 community health workers have been deployed to strengthen the surveillance and contact tracing, health experts caution that the current efforts remain insufficient to contain the rapidly expanding outbreak. Now, the World Health Organization and humanitarian agencies are appealing for increased international support, warning that the response efforts remain severely underfunded. And experts estimate that only a fraction of the hundreds of millions of dollars required has been secured, leaving critical gaps in the surveillance, treatment, and also the community engagement. Health experts say that strengthening contact tracing plus expanding treatment centers and increasing community awareness remain essential to preventing further spread of the disease, both within the Democratic Republic of Congo plus across the neighboring countries, including Uganda. Now, health authorities continue to urge communities to report the suspected Ebola cases immediately and avoid contact with infected individuals, plus cooperating with the surveillance teams as regional and international partners work together to bring the outbreak under control. Now, moving on to our the story for today. Now, the United Nations World Food Program says that Haiti remains the center of the world's worst hunger crisis, with millions of people struggling to access enough food as violence and displacement plus natural disasters continue to deepen the humanitarian needs. Now, the warning comes from the World Food Programme outgoing country director for Haiti, Wanja Kaira, who says that despite the country's enormous challenges, the resilience and determination of the Haitian people continue to inspire humanitarian workers. And according to the World Food Programme, millions of Haitians are facing severe food insecurity as armed violence and also economic hardship plus repeated natural disasters disrupt livelihoods and also limit access to the essential services. So Kaira says that when she arrived in Haiti 2 years ago, she was struck by both the country's natural beauty and the warmth of his people. But however, she quickly realized that Haiti was facing one of the most complex humanitarian crises in the world, requiring urgent international support. And she says that despite relying on emergency food assistance, many Haitians continue to express a desire to become self-reliant rather than depend on aid for long years. So one of the World Food Programme's major intervention has been the expansion of its home growth school means programs with which purchases food directly from the local farmers to feed school children while supporting the agricultural production and boosting local economics. Now, the program has increased the number of children receiving school meals from about 450,000 to more than 650,000 over the past 2 years. And nearly 3/4 of the food served in schools is now sourced locally, creating jobs for farmers and improving household incomes. So this program has also provided stability for children displaced by violence, ensuring that they continue receiving nutritious meals while remaining in school. However, humanitarian conditions worsened significantly during the 2024 as the escalating gang violence forced thousands of families there to flee their homes, and also access to communities became increasingly difficult after the roads and ports plus the main international airport at Port-au-Prince were disrupted by the insecurity. And despite these challenges, the World Food Programme maintained its operations using the United Nations Humanitarian Air Service to transport the aid workers plus the humanitarian supplies and emergency cargo into the affected areas. So at the peak of this crisis in December 2024, the emergency was providing nearly 50,000 hot meals every day to the displaced families. So by the end of the year, more than 3 million emergency meals had been distributed across the country. So this agency also highlighted its response to the Hurricane Melissa, where early preparedness measures, including the distribution of the 3.5 million early warning messages and anticipatory cash assistance, enabled vulnerable communities to prepare before the storm made landfall and also recover more quickly afterwards. So Kaila says that the humanitarian agencies must increasingly focus on preparedness other than waiting for disasters to occur, noting that early action saves lives and protects livelihoods and also reduces suffering. She also warned that a shrinking global humanitarian funding is placing additional pressure on the relief operations, and even as the number of people requiring food assistance continues to rise, the World Food Programme says that it will continue providing essential services and including humanitarian air transport and warehousing plus fuels storage plus emergency food assistance, while working closely with the Haitian government plus international partners. Now, Kaira says that addressing the hunger remains critical to achieving the lasting peace and sustainability in Haiti, saying that food insecurity not only results from the conflict, but also can contribute to the continued instability. So the World Food Programme says that although Haiti continues to face one of the world's most severe humanitarian crises, the resilience of its people and its sustained international support remains key to building a more stable and also food secure future. Now, moving on into the story for today, the World Health Organization has released its first comprehensive clinical guidelines for the management of the filovirus disease, including Ebola and Marburg, in a move aimed at improving patient survival and also strengthening outbreak preparedness around the world. So the new guidelines comes as the Democratic Republic of Congo continues to battle an outbreak of Ebola caused by the Bundibugyo virus, highlighting the urgent need for standardized clinical care during the deadly disease outbreaks. So according to the World Health Organization, Ebola and Marburg are among the world's most dangerous viral diseases, with fatality rates ranging from 25 to as high as 90% during the severe outbreaks. So since 1967, Africa has recovered from more than 70 outbreaks involving the Ebola and Marburg viruses, causing widespread loss of life and also significant social and economic disruption. Now, health experts said that while the vaccines and approved treatments are available for some Ebola virus strains, there are currently no licensed vaccines or specific treatments for the Marburg virus disease, Bundibugyo virus disease, or Sudanese virus disease. As a result, early supportive medical care remains the most effective way to improve survival. So the WHO's Director General Tedros says that the new guidelines demonstrates the organizational commitment to using science to strengthen the outbreak response and also protect vulnerable communities. He also noted that the ongoing Bundibugyo Ebola outbreak underscores the importance of timely, high quality and patient-centered medical care. So these guidelines were developed through consultations and also international experts and are based on the latest scientific evidence and lessons learned from the previous Ebola and Marburg outbreaks across Africa. So they are intended to help the frontline health workers and also provide consistent plus evidence-based care while enabling governments and health facilities to improve preparedness through better planning and adequate medical supplies, plus the laboratory support, plus biomedical equipment and the trained personnel. So among the key recommendations is the use of the priority laboratory tests to quickly identify complications such as low blood sugar, dehydration, plus metabolic disorders that can be treated before they become life-threatening. So the guidelines also emphasize a rapid oral and intravenous rehydration to prevent severe dehydration, as well as early use of intravenous fluids and medications to stabilize patients suffering from the shock, and one of the leading causes of deaths in severe Ebola and Marburg infections. So health workers are further advised to promptly identify and treat the bacterial infections, including the sepsis, with appropriate antibiotics whenever they occur. So alongside the viral infections for patients who recover from Ebola or Marburg disease, WHO recommends a structured follow-up care to monitor the long-term health and also support the maternal and physical recovery and reduce the risks of further infections linked to the viral persistence. So the organization says that early recognition of the symptoms plus a rapid referral to treatment centers and optimized supportive care remain the foundation of effective patient management, especially in outbreaks where vaccines or antiviral medicines are unavailable. So WHO is urging all the governments plus health authorities and healthcare institutions to adopt the new guidelines as part of the national preparedness and outbreak response strategies to improve the quality of care and save more lives during the future health emergencies. So the World Health Organization says that strengthening clinical care, investing in preparedness, plus ensuring a rapid access to the treatment remain essential in reducing the deaths from Ebola, Marburg, and other deadly viral diseases. Now, to our dear viewers, that brings us to the end of this edition of TV1 Health Updates today. So thank you for making us part of your evening. So as we continue to observe the men's mental health today, stay with us after the news for a specific discussion about mental health. We will be exploring mental health in deep, and also remember that strength is not measured by silence. It is shown by having courage to ask for help. So in today's mental health show, we shall go deep into our mental health, and on behalf of the entire TV1 Your Health, have a very pleasant evening, and stay tuned for our special discussion coming in for Face of Mental Health by Mrs. Sozi Becky. Then we come back with that.